I should be all set is a great way to put it. Am I all set? Give me just another second.
Yeah, of course.
Jackie, I'm going to ask you to fill in any of the gaps in the notes section that I'm missing
Yep.
because of Outlook, but I think we should get started. Welcome everybody and thank you so much for joining us. We've got probably just about, I don't know, 15, 20 minutes worth of material to present and then plenty of time for questions. And I suspect we will end early. So I'm going to ask Jackie, our program coordinator, to move us through the agenda and then we'll get started. Today we're going to give you some updates on our CGM training program. We're going to talk about our clinical champion training, the materials we'll make available to all of your providers and how we'll do so. We're going to talk a little bit about our patient advisory board and our initial meeting with them. We're going to give you some updates on the Learning Collaborative and how that relates to value-based reimbursement, and then we'll talk about our dietitian role. You probably all are aware that we've made this really wonderful opportunity for clinicians to have access to a CGM sample for themselves so that they can try it, understand what it's like to read their own CGM, put themselves in a patient's shoes, and then think about how we would integrate that information into our EMRs. So your providers will have had the opportunity to use a Dexcom G6 and an Abbott Freestyle Libre. We received the CGMs on the 9th, and so we are planning to ship those out on the 20th to clinical champions who've already responded to us that they want one. Our Dexcom G6, we did get information about who was interested. And so, Jackie, if you want to put that link in the chat, or we'll give it to you in an email afterwards, we would be very happy to send either or both of these to your clinicians since they are a little bit different. In terms of how to use these and how we think it will help physicians and clinicians counsel patients, Jackie, I don't know if you can kind of take us out to the internet, to our website, and take a look at the handout that we have pictured here on the right.
Yep, absolutely. Give me just 1 second. Also, I wanted to let everyone know that we will be offering drop-in sessions for everyone for the Abbott Libre on how to apply them, how to put them on, and we'll get those dates out shortly, and we'll be sending those dates in the guide that we send to patients or to providers who are receiving one. I'm sorry. Give me just 1 second and I will pull up that document that Dr. Ashman just mentioned. Give me a sec. Trying to click it from the window is not going perfectly. And these are all attached on to the invite as well. So you have the PDF of our slides where you can access all of these links too. So this is the booklet that will be sent out to each of your clinical champions when they receive their Abbott CGM. So it has what's included, getting started guides, a link, some instructional videos. So they will get this entire kind of packet along with their CGM that we'll be mailing out on the 20th. So everyone should have those soon. And as part of that, we're going to include the information about these optional drop-in sessions. So if they want one of us on our team to walk through inserting the CGM and answering any kind of questions about that they have, we'll provide those opportunities to them. So, but we did also include a lot of instructional options here for them to do it on their own as well if they prefer.
Exactly.
So, yeah. And
So
this is, as you
go
saw
ahead.
on our website, and accessible there. Sorry, go ahead, Dr. Ashman.
You said what I was going to say, which is to the start of meeting clinicians' needs as your providers have kind of told us what they want to be more successful with our initiatives. Lots of requests for patient-facing information and provider-facing information. So we're hoping to get them used to going to MCT2D, our website, to the resources section to start to download these. And so we're going to go over that in more detail next month as we'll have more of those resources available. Sorry about that. Next slide. So just to summarize what we already told you, we are really happy that Abbott is going to be providing some live training sessions. The Dexcom team already provided some training sessions. We, as always, are not preferring one over the other. These are just the two that are available to our teams. Sorry about that. And so thinking about what your providers, if you're interested, are really most interested in learning in order to make their use of CGM more successful, it's the sharing data from patients to the clinic. And so as I'm thinking about how we're helping you and how you're helping your clinics become efficient at doing this, once they figure out how to get patients started on their CGM and get that data download set to the clinics, I think it's going to be smooth sailing. But that piece of the puzzle is going to be really important for the clinical champion and the rest of the administrative and clinical staff at your offices to be able to manage. Downloading CGM data from LibreView is important. Teaching patients how to set it up is important. And then asking them in free text what else is important, clearly affordability. And so that will segue into some of the other resources we're providing to them to really understand how to make sure that they know which insurances are going to cover CGM for which patients. We don't want to waste our time on this. Next slide. So patient-facing videos, I don't think we need to link out to show you these, but we will have links on our website as well for providers to share with patients. If a patient just says, provider says, go to the MCT2D website, they're both links to patient training from Dexcom and Abbott. The Abbott ones, I believe, are on YouTube, and the Dexcom ones are nicely organized on their website. And so that's really important resources for us to be able to provide to patients as well. Next slide. The last thing about continuous glucose monitoring that I want to share is that we do have an opportunity to have patients share their CGM data with the collaborative so that we can use that as part of the host of data that we have to figure out both, who's using CGMs and are they beneficial and how are they beneficial in type 2 diabetes. And so our accelerated slides already have these handouts that we can share with patients. And I think this is for any patient who is willing to allow their data to be shared with the collaborative so we can learn from them and we can make these handouts available to you. Jackie, any other comments about that?
Nope, we just wanted to show everyone what these were like. We're going to see how it goes with the accelerated sites and patient sharing data. And if it goes well and we decide it's worthwhile, we'll distribute these to you as the POs in early 2022, but we'll do a little bit more evaluation before we get to that point. And this is just this next slide, inside of that kind of trifold that gives the patient like the specific steps of how they would do this if they want to. And of course, it's completely optional to share this data.
Next slide. So I appreciate the comment in the chat about the videos being useful. I'm really glad you're using them, whether you get them through us or like me in a patient clinic, kind of Google search and lead it. It's really easy to put them on. It's very, very simple for patients. Similarly, for our injectable GLP-1s, which is all of the medications in this class except for Rybelsus, each of them are a little bit different, and we couldn't find excellent videos that were comprehensive, and helped us get away from being brand specific to help you with all of them. And so our pharmacist, Heidi Diaz, is getting demo samples, and she's going to record videos that will be available on our website and on YouTube. So stay tuned that we'll be able to utilize those in the same way as you're prescribing a GLP medication and want to give the patient a video to review. Next slide. thinking about our training videos, again, many appreciations to all of you who have worked with your clinical champions and other staff to take the training videos. We have just a couple of sessions left, and then almost all of them have been recorded. The medications one is the last one that will be recorded. So final session will be December 17th. And then Jackie, can you remind me when everyone will know? When will they get the report about everyone who's been through the training?
Sorry, I was muted there. That can be viewed via the dashboard link that we've sent everyone. So we haven't been updating the registrations, but we've been updating the attendance. So that's, live minus a couple days. Basically, there may be a small lag before we enter in a session's attendance records, but shortly after that last training session on Friday, December 17th, you should be able to see who has completed all of their training and is completely set, and who maybe missed a couple sessions and needs to make them up.
Awesome. Next slide, please. And so we were able to access on-demand CME credit from Beaumont. And so we've been asked a number of times by clinical champions, how can I get this material for other physicians, APPs, pharmacists, other people in my practice, and we will have that available likely by early January. And so for champions who've missed the required sessions, or anyone else who wants to be able to watch them, clinicians are much more likely to do this if we offer them CME credit. And so that is our intent. Whether it's through the CME evaluation or just a link to our website, we want to find a way so that people can submit their questions. The intent of having this live was to have that robust discussion, and so we want to make sure that people who watch these CME offerings later get that as well. Next slide. So as you're talking about this with your practices, if you'd like, we plan to make a short survey that you would be able to distribute to providers on the practice level, just to ask about their level of comfort and experience with each of our initiatives: low carb diet, CGM use, and newer medications. And the way we think that might be helpful is if you're identifying team members who have either low confidence or low experience, and we know that your clinical champions are time limited in being able to provide a lot of this education one-on-one, you may want to encourage them. You might want to build time out for them to do this. You may want to provide an opportunity, especially for those who report a lower level of baseline training, to use these modules for continued education. We're not going to require that at all, but we certainly did hear from you and our attendees that it might be helpful. Next slide. So just a clear deadline: by March 31st, all of the clinical champions, all of the people who are required to complete training for VBR, need to have completed the training by that point. You're going to get a little Christmas holiday break between December 17th and the last session, and when we get these online for viewing in January, and then they can complete them in that time. Jackie, anything else to say about that?
Just that, like with everything else, we will update you on anyone who isn't meeting this, on anyone you need to follow up with. This won't come as like a surprise. We're not going to follow up with you on March 30th and say all these people are going to lose it tomorrow. It'll just be, we'll ongoingly let you know, like, of your clinical champions, 17 out of 18 have met it. The one who hasn't, this is who it is. This is what they still need to take. And it should be fairly simple to fit that all in with this deadline, and the fact that they will be on demand and can be done at any time that they would like to. So, yep.
Thank you so much. Next slide. We're a little out of order. We're going to go to dietitians next. So we have added to our team our pharmacist, Heidi Diaz, who is really helping us with some of the medication insurance and other aspects of the MCT2D program. Similarly, we're planning to hire a dietitian. What we've heard from you is that access to dietitians who are comfortable teaching lower carbohydrate diets is a barrier. And so we're planning to have someone join us in a centralized fashion to help support you. Next slide. So what we are hoping, based on your input so far, is to have our dietitian build tools, as we've been doing for our other initiatives, focused on patient tools, starting a low carb diet, provider tools, giving that counseling. We're hoping that we might be able to set up some virtual patient support groups that could be statewide. We're hoping to meet the language and cultural proficiency of our patients. We're thinking there will be a great opportunity to do more provider education, maybe for smaller groups over the next year. And so if you would like to unmute and let us know, or just type into the chat, now would be a great time to let us know, or by email later on, what else you think that a dietitian might be able to do to help you with lower carbohydrate diets and MCT2D.
Maybe even dietitian to dietitian work groups. So having those conversations to help other dietitians who are unfamiliar or don't routinely do low carb, dietary, methods with patients, that sort of teaching, maybe just having those work groups together. But I obviously, like you said, lead provider education to other providers, but I think just dietitian to dietitian would be really important too.
That is a great idea. Thank you so much for suggesting that.
Yeah, I think train the trainer so that when we as clinicians refer you to a dietitian, they get the support they need. Anything else? Going to give an appropriate amount of silence here in case anyone wants to unmute. Otherwise, please add anything you could think of as we go along to the chat, and we'll move on to the next slide.
And this will, of course, be iterative. This isn't going to be your one opportunity to ask for things from this person, specifically with like tools and things like that. We'll let you know when this person's been brought onto the team as well, and we'll let you know some of the initial things that they're working on. And then if you hear from your providers, other handouts or videos or any kind of support that it would be great for a dietitian to develop, we will absolutely make sure that that is an ongoing conversation similar to with our medications and the other things that we make tools for. Okay.
All right, we're going to move on, and in the chat as well, written network of dietitians that provide lower carbohydrate diet. And so, Jackie, I think that would be a great kind of needs assessment to start with for the dietitian, identifying in our regions, using our regional structure to do that. Thank you.
Yeah, thanks, John.
Next slide, please. So we're very excited that we've gotten our initial patient advisory board meeting launched. As you know, starting any of these initiatives is a lot of work on the ground floor. And so thanks to Jackie and Jake and everyone else on the team that made this happen. And thank you to you all for submitting the names of patients who were comfortable and agreed to participate in the advisory council. So we were able to hold our first board meeting on Wednesday, the 1st of December. We were able to have 12 of our patients who you nominated attend. This was not really a highly packed agenda. It was just a time to orient the patient advisors to the MCT2D program. We've got a code of conduct to kind of talk about what we expect from patient advisors and just start to build a network and rapport. Next slide. So this is where we're starting with our first 12 first 10 patient advisors who attended this particular meeting. We will have more people attend future meetings, but gender fairly balanced between male and female. In terms of race, we'll gather more data about race and ethnicity as we go along, but primarily identifying as white of the 10 folks that joined us for the first call. Employment status, some people who are employed, some retirees. I always expect to get a lot of retirees in these opportunities, so I'm glad we have some employed patients as well. And then in terms of therapies tried, most of our patients who volunteered have tried metformin, several insulin. At least half have already talked about or tried a low carbohydrate diet, and 3 have tried a continuous glucose monitor. Several have tried most of the other medications that we use for diabetes. So I think this is really interesting background information to see. Duration of type 2 diabetes, 13 years. The information we're interested in gathering, as well as some regional variation to know where in the state people come from, maybe kind of what insurance or other barriers they have to care. Our goal as we develop this patient advisory board is to make sure that we reflect the diversity of the patients that we serve in the state of Michigan. And so as we go on and ask you for more nominations for patients, we are going to be looking for more patients who identify as people of color, because we do want those that diversity to be represented in our patient advisory panel. Next slide, please. Just reading through the chat. Current evidence support advocacy with patients and payers for coverage of CGM and type 2 diabetes. Jackie or Jake, do you want to talk a little bit about the one-pagers maybe that we have developed already for coverage of CGM and evidence while I talk through this next slide, and we'll get to that chat comment in just a second, if that's okay? Just to summarize and complete just the discussion about our first patient advisory board meeting, we talked a little bit about what brought people to take this opportunity, what was their experience, and I just wanted to share with you some of their comments, thinking about what was the hardest part about having type 2 diabetes in your life, the constant monitoring, managing diet and food cravings, and guilt. We know diabetes distress is a big deal for people with diabetes and their families and caregivers, guilt about feeling like they did this to themselves. And their greatest source of support, another great icebreaker, having a doctor who's supportive and encouraging, so that's really wonderful to know. And then patients who were able to use their CGM, I think, Jackie, you can provide the quote from this one, feeling like it was a lifesaver and really helpful to them.
Mm-hmm. Yeah, there was a lot of great comments about CGM among the patient advisory board session, where a lot of people just thought it was really a game changer in managing their type 2 diabetes, and that it's just given them such a feeling of control. So it's really nice to hear it, how impactful it was.
So Jackie or Jake, any comments about the evidence behind CGMs and advocacy with insurers and PBMs?
Sure. So Dr. Manzabar, are you asking like for us to provide something that you at the POs could use to advocate for this as well, in addition to what we're doing, or just for us to kind of share what we've been sharing?
Thanks for the question, Jackie. I am actually asking for easy to share information that we can also, because we at times have conversations even internally with our own self-insured products or other payers. And so, so that we're using the same set of evidence and verbiage and language, that would be very helpful to have.
Absolutely. Thanks so much for bringing this up. So yes, we can pull together some information that includes links to publications and a really clear demonstrated current evidence for these things for coverage of CGM. And we can also create something similar around the medications, maybe more around making them more affordable and that type of thing for patients too, so that we can have both and support anything that you're doing in your own advocacy for sure. So we will absolutely add that to our to-do list.
Thank you very much.
Yeah.
Okay, next slide. All right, last topic that we wanted to touch on today is talking about our Learning Collaborative. And this is really just focused on giving you accurate information regarding VBR as we're getting to that part of the year. The way I'm thinking about this is as if it were an online group like Doximity for Doctors or Facebook, where you see a patient with a complicated issue or a side effect, and you post something about, has anyone else seen this, or what would you do? And other people are able to then comment on it. So we're building a standalone learning collaborative. We didn't want to house this with any other existing social media sites. And the requirement will be for the physicians earning VBR to post at least once. We're hoping that if the collaborative is successful, as we hope it will be, it will just create that ongoing generative conversation where people are then commenting and replying to their own concerns and questions, and really creating that space where providers feel like they have support. Obviously, the program directors, our endocrinologist on our team, Heidi, our pharmacist, we will be kind of commenting and help facilitating, but it's really meant to be peer-to-peer help. Currently, this is in development. We're still working through legal and technical components of the build. So if for any reason we have not had the collaborative developed in a timely enough manner for people to feel like they can post in a helpful way, we will either remove this from your this year VBR requirement or have it turn over into next year. So certainly not an expectation to make this punitive. We want to do it the right way. And if that means it's not done in time, then we will remove it from VBR for this year. Next slide. So just an example, we're going to keep all of the information de-identified, kind of have a warning for clinicians who are using it that they should not have any PHI on the Learning Collaborative posts. So someone who might have a patient with CGM results that they're unsure about how to interpret, they could post that. They could place a de-identified screenshot and then someone might respond to it. That would be the kind of thing that someone might post. Next slide, and then we'll leave some time for questions or comments. So just orienting you to what's coming up, you should have received your region review links on December 10th. We'd like you to review and request any changes by the end of the month, which is coming up soon, believe it or not. Our last live training session will be Friday the 17th. And so as we said before, you're going to have that list of who has completed required training and who needs to make up sessions. And then just a final reminder about practice change readiness assessments. We'd like to have these by end of December. That is our final due date, and that is required for VBR. And so we will be reaching out to you and then follow up again towards the end of the year so that no one misses out on that deadline. Next slide.
Oh.
And then Jackie, I'll let you share with everyone else the comment about VBR.
Yes, so as far as for the time frame to like be using the Learning Collaborative, as soon as we like have it up, really we would just relate it to this VBR year, which is we started the MCD2D VBR on October 1st, and so it goes till that end of September. So we would want to give everyone plenty of time, meaning like multiple months, to be able to post this. So if we didn't have something feasible by probably like April, we would likely remove that requirement.
So from there, we can close share screen and leave time for questions, comments, how things are going, what you need from us. Jackie, I'm going to turn it over to you to clarify anything I missed.
No, I don't have any other clarifications, at least from my end, but happy to answer any questions that anyone has, either about the slides that we posted or anything in general that you need to know.
Jackie, do you want to take that question?
Yes, so like one of the ways that we're asking for feedback is like via those case studies that are required, where there's like 3 that we need to have like any VBR clinician like giving information on. And we have it set up for those that it doesn't need to be the clinical champion filling it out or the provider filling it out. It can be like the clinical champion or project coordinator taking back that feedback and using that to fill those out. So yeah, we absolutely want to accommodate like that team-based approach and want to hear from all the members of the team. And if that's the best way for you guys, that's perfect. Mm-hmm.
Thank you.
Yep.
Anything we can do to offload work from clinicians or send it to the person who's able to do it, we're happy to do. Other questions?
So there is a link, Erica, that you can see now on like the VBR dashboards that we created for you, where for case studies, for pretty much everyone, it says 0 of 3 submitted, and then there's an option to link it. And it's like, I can show everyone really quick just so you can see what it looks like if you give me 1 second to pull it up. But it's a fairly short form that's really just asking, of like the 3 patients that they report these on, because that's about how many we asked for the VBR requirement. Really, it's kind of covering what went well, what they used, what they needed. So trying to identify things that were helpful for them that we can share with others, or learn what things they may need. So let me share and show that form to you super quickly. And we'll also link it on our website too. I think it is linked, but we'll make sure that everyone knows where it is. So this is where like the clinical champion who's not a physician could be filling this information out. So it doesn't need to be like the PCP or the physician. really just noting what intervention the patient received, what barriers was this patient facing related to their type 2 diabetes. So maybe they were continually gaining weight and like struggling with their diet. So we give them a CGM and a low carb diet counseling, for example. So we would ask you to fill this out later, kind of like what went well with the intervention. Did it achieve the right outcomes that you'd hope for? What challenges were there? So maybe something wasn't covered, or they weren't sure, the patient didn't want to do this or didn't see the benefit of it. It could be anything like that. Resources that you use that would help others. So if someone has a tool that's really amazing and that's been helpful for them that they always use with patients, we want to know about it. And what do they wish they had next time to make this easier? And we'll add something where they can attach a tool if they're willing to share it as well, so they can add an attachment if they like. But that's pretty much it. We're just asking that this be submitted 3 times over like this VBR year by the physicians earning VBR, so that we can kind of see what's going well, what's not, where they need additional support and tools.
Thanks, Jackie.
Yep, thanks.
Sorry, I'm muted. Any other questions, comments, concerns, successes to share?
Okay, well, thank you so much, everyone, for your time today. We really appreciate it. Of course, reach out to me at any time with any other questions you have, and hope everyone has a nice holiday if we don't talk before then. Before, it looks like there's one question from John in the chat: who would be monitoring the collaborative to make sure PHI isn't shared or in any other issues? So that'll be us at the coordinating center. We would have like a hold on everything before it was posted, so that someone on our side would be looking and verifying to make sure that's accurate, in addition to hopefully asking people to not put it in the first place. All right, thanks so much, everyone. Have a great afternoon.